welcome to our psychiatry grand rounds. Today I have the pleasure of introducing Dr. Rachel Miller-Slough. She comes to us with an extensive education background from College of William & Mary in Williamsburg, Virginia, to Virginia Tech, and most recently Duke University. She has a very impressive and extensive resume, and I'm going to let her fill in the research that she has done at her request. Welcome to our grand rounds.
All right. Good morning, everyone. Thank you so much for having me. So I'm very happy to be here today. I'm going to be talking about some of the research that I've done so far at some of those exact institutions at William & Mary, at Tech, and some of the projects that are unfolding now. So I'm an assistant professor in the psychology department here at ETSU, and I am a clinical child psychologist. So while a lot of my research training is very much informed from a developmental psychology approach, I also do clinical work with youth and families, and so I'm often thinking about ways to translate what we know from developmental psychology into the therapy room. So that's one thing that will be very much baked into this presentation. I'm just going to review some of the research in my topic area, which is on emotion socialization, how kids learn about emotions from various figures in their kind of social landscape, and then also talk about how this process, which is a very dynamic transdiagnostic process, is linked to some of the outcomes that we see in clinic. So how it's linked to internalizing symptoms, externalizing symptoms, emotion regulation difficulties. And then I will end with where we are taking some of this research, my lab here, the developmental psychopathology lab, and then also some other teams I'm collaborating with at other institutions regarding how to deliver some of the interventions that have been based off of this body of research, and particularly how we tailor it to promote healthy families here in Appalachia, because it's a process that is very much bound by sociocultural context. So we want to make sure we're delivering culturally sensitive interventions. I have nothing to disclose. Okay, so where I want to start is talking about what emotion looks like over various stages of development. So you think about an infant, someone in early childhood, a middle childhood, school-age child, or a teenager. All those developmental stages have very different expectations for, one, what kind of emotions we're seeing pop up at that time, how they regulate, whether they're co-regulating with a caregiver or whether they're expected to regulate more independently. And then also how complex and nuanced those emotions become. So when we're thinking about the infancy and early childhood years, emotions are expressed to communicate basic needs, and most often those emotions are co-regulated with the caregiver. So there's a lot of scaffolding and support for them to regulate their feelings. Whereas when kids are getting into the middle childhood age, their cognitive development is ramping up a bit, and they're gaining a better understanding of their own emotions. They're learning a little bit about the emotions of others. Some of that perspective taking is coming online. And they're starting to regulate a little bit more independently. And part of that is based on the different contexts they're in at this point. They're spending more time with friends. They're in the school environment where they have to be able to regulate their emotions to fit that context. And then we get into the teen years, which is where my particular area of interest, where I'm doing a lot of research right now. And that is developmentally a very interesting period, because at this point they're expected to be much more independent in regulating their emotions, and they also have to have knowledge of these display rules. When is it appropriate to show emotions in different contexts, and when is it inappropriate? So one task that we do at a variety of stages is called the disappointing gift task, where we give a child a disappointing gift and see if they can suppress the initial emotional response, disappointment, and regulate that emotion, and then present the emotion that is appropriate for that social context, which is to express gratitude. And we've done this task with 4-year-olds. I've done it with 10 and 12-year-olds, and you see the change over time. Some of the 4-year-olds just kind of look at it and they say, I also like other presents, and they hand it back to you. Some of the older kids, they understand, they've internalized the display rules now. They look at it and they go, thank you very much. And you say, oh, I realized that was the wrong gift. No, that's the one I wanted. And they are realizing the politeness and the appropriateness. So it's becoming incredibly nuanced, and that has implications for emotion regulation and mental health as well. So one thing, just to make this very clinically relevant, for those of you in the audience who are providers, I want you to think about one of your child patients or a family that you know, And just consider the following questions. When you're working with this patient, how does the parent react to your patient's emotions? Do they provide a response that's very supportive? They're not acknowledging the emotion, they're maybe a little bit dismissive of it. And is that considered, in your opinion as the provider, a helpful or unhelpful response in the context of what's occurring? And then also, when I'm wearing my clinician hat, one thing I'm often thinking of is how the parent is expressing their emotions. What's their overall positive affect like? Are they really high in negative emotionality? Are they really suppressing most of their emotions? It's hard to get a read on how they really feel. And then one thing that we see more in the therapy room, but you might see in like a primary care appointment as well, is how the parent and child are discussing their emotions together. So do you notice the parent validating the child's emotion, or do they go pretty much the cognitive route and immediately start problem solving? We see a pretty similar dynamic when you do research in couples, where oftentimes one partner is wanting to just be able to express the feelings that they're having and have a sounding board, and the other partner is wanting to problem solve, and that the first partner feels like that's very dismissive because I just want to express my feelings, and they're saying, well, I'm trying to help, I'm trying to solve the problem, but what is, we often want to attend to the emotion first and then work towards problem solving once the emotion part of the brain has regulated a little bit more. Another dynamic I see in therapy sometimes is, do they have a hard time moving off of the issue that made the child upset? So sometimes, and I do some research in friendships too, you can see a similar dynamic where they kind of get stuck in talking about the problem. It's kind of a circular conversation, and they have a really hard time moving off of it, and that can be really dysregulating for kids too. So just some things to consider when you're thinking about the patients that you're seeing. So now I'm going to start with just defining some different ways that we measure emotion socialization, which overall that's the process through how kids are learning about their emotions. And they can learn about their emotions through interacting with their parents, their teachers, their friends, extended family members. And so a couple of the strategies that we measure in the lab is one, modeling emotions. So they can just, through imitation, through observation, they can internalize ways that they can see it's appropriate to express emotions in their social context. So parents may model their own emotions, and the child's observing how they react to different scenarios, and they're getting a sense of how to react to those. They're doing a lot of social referencing, checking to see how a parent's reacting to a situation to gain that knowledge, but also how the parent, or any individual really, but we mostly in the early years focus on parents, how they respond to the kids' emotions in the moment, that live feedback. So one of the vignettes that we use in one of our questionnaires is, imagine that your child fell off their bike, skinned their knee, and starts crying. How would you react? And there's a variety of ways parents can select their response. They might say, I tell them to stop being such a baby and just get on with it, or they might select a response like, I comfort my child, or I help them fix the bike, very problem solving. So that live feedback to the kid about how acceptable their response is. And then one area that I've recently done a lot of research in is this discussing past emotional experiences, so what we might call reminiscing, where in the lab we have a parent and their child talk about a past upsetting time and a past happy time, and we just observe how the parent is responding to that discussion. Are they really scaffolding it, facilitating it, helping the child explore that event? Particularly for younger kids, we've found that that has been really helpful because they're still developing their schemas, their reasoning about different events, and so reminiscing on an emotional event with a caregiver after it has occurred is a nice, emotionally cool time to be able to really reflect on what happened, and then for the parent to maybe do some guided questions that can help provide some direct instruction on maybe what to do next time. So they have a better chance of kind of gaining some emotion regulation skills from those discussions. And then lastly, we have niche selection, and this is one that's mostly been researched with parents. This is more of an indirect socialization strategy. This is when parents are selectively putting their child in certain environments based on individual characteristics of the child. So for example, if I have a 7-year-old and I know that he is highly sensitive, very prone to negative affect, I might think about whether or not I want to enroll him in a competitive sports extracurricular, because that could be really dysregulating for him potentially and not a good fit for his temperament or his, how I feel like whether he would benefit from that. And so you're seeing ways in which parents are purposely putting their child or not putting their child in certain environments based on how they anticipate they're going to react. All right. So then, as we're thinking about how this socialization process unfolds, I often refer to Bronfenbrenner's ecological model to think about the different levels of influence that may moderate how this process unfolds. So for example, at the individual level, I'm thinking about things like how the child's gender is going to influence socialization processes. A large body of research shows that how parents and teachers respond to kids' emotions really falls along gendered lines. So oftentimes girls receive a lot more encouragement for expressing their emotions, but then when you look at discrete emotions, you see that it really breaks down by gender, where and granted this has all been done with cisgender youth, so this is an area that's going to be continuing to develop in research, but girls often get a lot of reinforcement for expressing more of those vulnerable emotions like sadness and worry, and then boys may receive a lot more encouragement for emotions that fit within kind of male stereotypes of more expressing anger and not expressing sadness or worry. And you can see that in some of the messages that some kids get. So it's not very ladylike to be angry, or don't be a girl, don't cry. There's all different ways in which they're getting some feedback about ways to express their emotions that end up having an impact on their mental health in unhelpful ways. Then also looking at the mesosystem, so this is the immediate family, which we'll talk about a lot today. Parents bring a lot to the table too in terms of how this process unfolds. You see a lot of intergenerational patterns in how families are socialized to express emotions. So whether consciously or not, parents are bringing their own childhood histories of how their emotions were received, and that could, some parents kind of develop in reaction to that, so they purposely choose to respond to their children's emotions differently than how their parents responded to them. Or you could see a lot of consistency across generations. And then another piece of that is the parent's own emotion regulation, which is something that we target a lot in therapy, helping parents learn, because it's very upsetting to see your child upset, and so helping parents practice their own emotion regulation strategies so that it can better help them support their child, because sometimes it can be very dysregulating. We'll also talk a little bit about these outer rings, so the exosystem, so we'll talk about friends, and then the macro system, that's where we'll end today, talking about some of the sociocultural influences on how emotions are expressed. So there's going to be cultural norms for what emotions are appropriate and when to express them. And I'll particularly talk about the sociocultural context of Appalachia and how that can inform our care with families. All right, so we're going to delve into one of those tiles of how to socialize emotion, and that is discussing emotions, reminiscing on past emotional experiences. I just want to highlight some of the constructs that we often code for when we review the tapes for these conversations. And some of these have been developed out of the parent literature. Some of these have developed out of research that's been done with friends in the adolescent years, because friends are increasingly important during that developmental stage. So first we've got emotion coaching and emotion dismissing. This has mostly been researched with parents, and this is based in, rooted in kind of what the parents' beliefs are about emotions. So a parent who has an emotion coaching philosophy views that emotions are important. They're a teaching opportunity, they're an opportunity to become close with your child. Emotions should be expressed. And so the behaviors that translates into is often encouraging their child to talk about emotions, or maybe if their child's seeming distressed, kind of probing to see if anything's going on, and then offering opportunities to talk about their feelings, provide some validation, it's okay to feel that way, and maybe do some problem solving around things to keep in mind for the future. Then you have emotion dismissing, which is based in a belief system that emotions are dangerous, they're bad, they should not be expressed. And so the behaviors that would translate to is really actively discouraging a child's emotional display. And perhaps either it also can kind of on a lower level look like minimizing, like that's not a big deal, that's nothing to get upset about, don't worry about it, which are all can be perceived as comforting statements, but it's also shutting down the opportunity to talk about emotions. And so that is one process that we see happen in parent-child dyads as well. And then lastly, we have co-rumination. This is based on some of the work of Amanda Rose, and she did a lot of really fine-grained analysis of adolescent friendships and found this dynamic that was presenting itself in a lot of emotion discourse, in which it kind of is that circular conversation I mentioned at the beginning, where there's a lot of focus on kind of picking apart the event, dwelling on it, rehashing the details over and over again. It's typically associated with high levels of high relationship quality, high closeness. It's also in parent-child relationships highly correlated with like an enmeshed family system, lack of boundaries. But it is circular. It doesn't move forward towards any problem solving, and that's where we see a lot of where you kind of get stuck in the emotion and the event and have a hard time moving off of it. So it has some similar features. This graph here shows it has some similar features as emotion coaching in that you're acknowledging the emotion, but there's not a lot of emotional guidance in terms of how to cope better next time. And so this is a really important, looking at these dynamics is a really important transdiagnostic process, because what we see is typically that practices like emotion coaching are typically associated with lower rates of anxiety, depression, better emotion regulation. Also, practices like emotion dismissing are typically linked to higher levels of oppositional behavior, because receiving a dismissive response can be really dysregulating for kids. But one thing that we've increasingly looked at in the research is that would basically paint coaching as always being good and dismissing as always being bad. But in reality, there's a lot more nuance. It's more about how flexible parents are in responding to their emotions, because if you think about, you've got a teenager and you validate every single emotion they have, there's a lot of emotions during that time, and they're also learning the rules for how to regulate. So you could end up reinforcing some really dysregulated emotional displays. So it's more about the context of the situation and if there's flexibility in their responses, so that kids can receive a range of feedback about when it's okay and maybe less appropriate to express their emotions based on the goals of that context. So I'm just going to start off, I'm going to quickly review some of the studies that we've done in this area and then spend some time talking about how it translates to clinical practice. So one study that I did when I was at William & Mary was on how mothers and fathers respond to emotions, with the idea being that we're mostly in the lab researching moms. Moms are usually the ones who are bringing the kids to these study appointments. So it's really great when we can get, whether it's moms or dads or just both caregivers, whoever they may be, into the lab to get a sense of what the emotional climate's like. And one thing that we are thinking about is whether this idea of the flexibility, so using a divergence approach to understand overall family patterns and how parents are responding to emotions, with the idea being that if you look at the overall family pattern and there's a lot of variability, that may be linked to really good outcomes, because kids are not consistently always getting encouraging or discouraging feedback. And so that is what we tested out. We had 51 kids come in with their parents, and we had them do an interaction task, and then we had them fill out some questionnaires. And so one of the questionnaires was that vignette that I mentioned, where they respond to how they would report how they'd respond to their child's emotion in a series of different scenarios. So it wasn't just, are you supportive of your kid's emotions? It was more grounded in things that they may actually be experiencing. And then the parents also reported on their child's social competence, internalizing symptoms, and externalizing symptoms using the CBCL. So first we just looked for what are those patterns. When we have data from mom and data from dad, what are some family level patterns that we're seeing, not just what is mom like and what is dad like. And 3 patterns popped up in the data. This is a 2-step k-means cluster analysis. And this first pattern we saw were parents who were largely supportive. So both mom and dad were reporting high supportive responses and fairly low unsupportive responses. Then we saw this second cluster, which we termed non-supportive, in that it wasn't that parents were really actively being discouraging, there was just like an overall lack of support for the child's emotions. So their unsupportive responses, this blue and green bars, were fairly low relative to the mean. These are all the Z-scores. And then this third pattern, which was the most interesting one to me because it fits with this divergence model, we termed it father dominant, largely because we see that it's the father's responses that are the highest. The fathers are reporting high levels of being supportive, high levels of being unsupportive. So overall, just being actively involved in their child's emotional world. And then mothers were right at a little bit below the mean for their supportive and unsupportive responses. And what we found is that the family patterns did relate to the child's outcomes. So parents who are mostly supportive, we see that those children have higher levels of social competence, also high levels of internalizing symptoms, because again, the child's receiving a lot of reinforcement for their negative emotions, so that may be internalized by the child and contribute to increased anxiety and depression. And then parents who were not supportive, we see the lowest levels of internalizing symptoms, but also mean level social competence. But then what was most striking to us is this father-dominant pattern, where we're seeing lower social competence, but also the lowest levels of internalizing symptoms. So when fathers were actively involved in their child's emotional world, those children had the lowest levels of anxiety and depression. And our thinking is that it was this divergence model. They were getting a range of feedback about their emotions, and that may be socializing some more flexible emotion regulation on the part of the child that they go on to use in their world. And so this is one way that this is in a middle childhood sample, so elementary school aged, and we overall are seeing families that are either fairly congruent or there's some divergence, and it's consistent with past research, showing that could be a really helpful pattern to have. Now I'm going to take us a little bit into adolescence, and if y'all have questions as I talk, feel free to raise your hand. I'm happy to talk as questions come up. But this study here, we went more towards what are the developmental tasks of those adolescent years. Because what we know is that this is a time of increased emotionality, coupled with increased expectations to independently regulate their emotions, but also a time at which youth are having a much higher risk for anxiety and depression. So a lot is going on. All that coupled with their school transition, so they're moving into a middle school environment, a high school environment. Their social relationships are becoming more dyadic, more intimate, so many aspects of their landscape are changing. And therefore, there's a lot of new social and emotional challenges to kind of navigate. So it can be a period of high stress for some teens. And so another unique feature of this developmental stage is who the socializers are. So we are mostly just focusing on elementary school age kids in this past study, but here we've got teens, and so friends become increasingly important as a potential socializer, someone who's going to provide feedback on their emotions and socialize things like emotion regulation or potentially risk for anxiety and depression. And so I find it helpful just to contrast how a parent-child relationship may be different from a friendship. And this is broadly true, I think, across many systems, not always the case, but in most instances, a parent-child relationship is a vertical relationship. So there's a power structure. The parents are in charge. Sometimes you see the inverse, but most times the parents are the ones that are in charge, and that's going to dictate how expressive the teen may be. But also we've got this, it is an involuntary and fairly stable relationship. So that may also lead teens to feel more free to truly express their emotions, particularly emotions that could be damaging to a relationship, like anger, because it's this involuntary relationship. They know at the end of the day their parents are still going to be there. Contrast that with a friendship where it is a horizontal relationship, so it's fairly egalitarian, and so that may lead to some more emotional disclosures, feeling safer, expressing your feelings. But it's also a very voluntary and transient one. So there's been some studies to suggest that teens may suppress some of their emotions around friends because they don't want it to damage the relationship. So there's some nuance there. And so for this study, what we were interested in is just differences in how parents and friends are reacting to teens' emotions, and then how that links to risk for emotion dysregulation and internalizing symptoms. So I did this as part of my dissertation, and let me just tell you, recruiting teenagers is tough, but getting them to bring their parents and their best friends is even harder. It took me a year and a half, and I got 30 kids. So I consider that a success, but it did limit our statistical power. So I had teens come in with their parents of their choosing, whoever they felt the closest to, because they'd be doing an emotion discourse task. And then they also brought in a same-gender friend of their choosing to participate in some aspects of the study as well. And so what we had them do was do this emotion discourse tasks. They did it independently with their parents and then independently with their friends. And I worked with the team to help come up with a negative event they want to talk about and a positive event. And they got 5 minutes to talk about each event with each of their conversation partners, resulting in 4 unique conversations. So they didn't talk about the same things with their parents and friends. And what we coded for were these socialization strategies I mentioned to y'all. So how often the other partner coached the emotions, dismissed them, or engaged in co-rumination. So really heavily dwelling and rehashing the event over and over again. And because I've done this task across several studies, and what sometimes you get is these social desirability effects where they're kind of on their best behavior when they're talking about their feelings. And so I also have the adolescents report on how the other person responds to their emotions, with the idea that if a parent is reporting on how they respond to their kids' emotions, you get the similar social desirability effects. But research shows when the other person has to report on how their emotions were received, that's where we get the highest accuracy in reporting. At least that's how it's coming across to the teen. The parent may have thought they were being super supportive, but maybe the teen, it felt dismissive to them, and that's what we want to know about because that's the feedback that they're internalizing. So they reported on both partners on questionnaires as well. We also measured emotion regulation, one through a psychophys measure, so heart rate variability, which basically reflects the capacity to engage in emotion regulation. So higher heart rate variability indicates that there's more flexibility, and so better ability to engage in emotion regulation. And then the adolescents also completed a standard questionnaire on that, as well as their internalizing symptoms. And it was a community sample, so I'd say maybe 2 or 3 kids were in the clinical range, but we saw some variety in internalizing symptoms kind of right at the at-risk subclinical range. Okay, so first just comparing what parents are doing versus what friends are doing. What we see very closely corresponds to the structure of each relationship. So parents are engaging in, this is the observational data, they're engaging in more emotion coaching. So they're providing a lot of validation and support and kind of helping guide them towards what to do next time. They're also higher in co-rumination, which was surprising to me, and also directly conflicts with the adolescent report. Adolescents think their friends are higher in co-rumination. I have some thoughts on this. It might be a bit of a measurement issue, but I'm happy to answer questions about that later. And then also you're seeing some consistency in the data here that teens are reporting their parents provide more coaching responses and more dismissing responses than the friends do. So again, in line with the structure of the relationship, the parents are taking the kind of control in the conversation. They're taking, particularly for the coaching, they're taking it as a teaching opportunity and kind of leading the child through the event. Whereas friends don't necessarily feel like it's their responsibility to guide their friend through their emotions. It's not really the nature of their role. It's a horizontal relationship. Now, when we compare these constructs against adolescent outcomes, what we're seeing is pretty much in line with what other studies have found with younger samples, which is that when parents provide a lot of emotion coaching, what you see is better emotion regulation skills in the teen through and this is the psychophys measure, so heart rate variability, and also they have fewer internalizing symptoms, all good outcomes. When parents are more dismissive, the child demonstrates poor emotion regulation. Again, with the idea being that having your emotions dismissed can be really dysregulating, so it is likely going to contribute to some more negative affect. But a similar process unfolds with co-rumination. That's also linked to poor emotion regulation, which makes sense in that if you're really dwelling and ruminating on an event, kind of dissecting it, processing it over and over again, you might be more upset at the end of the conversation than you were at the beginning of the conversation, because now you're really focused on how upsetting it was for you. And so there's a lot more potentially negative emotion after that. So one thing that was surprising to us is that none of the friend socialization responses were linked to any of the adolescent outcomes. It could be that the parent-child relationship's a lot longer. They have more of a history with that child, more of a socialization history, whereas friendships may have not been present for as long. But one other question that got us thinking is about whether there's just a little bit more nuance that happens in these friend conversations. In particular, looking a little bit more at some of the exact processes that break down when friends are co-ruminating, because that is the one construct that we know has a very strong link to anxiety and depression. It's been demonstrated across multiple studies within friend dyads. So we know something is happening there. And so we next look to what the specific features that go into co-rumination. So one thing that happens, this is just how we code it in the lab. One thing that happens is we look for mutual encouragement of problem talk, so asking questions or making statements that kind of keep the conversation going, even if it's naturally about to resolve. We also look for rehashing details, so if the friend is bringing up stuff that they already discussed, so kind of revisiting old conversation topics within whatever that upsetting event was. And then speculating about the problem. So thinking about looking for statements like, I wonder why she did that, or, I can't believe that it happened this way. What if it had happened this way? They're kind of all these different potential scenarios of how it could have unfolded, and they're really dissecting what else could have happened or why it happened. And then lastly is dwelling on negative affect. So if we notice the dyad spending a lot of time just focusing on how upsetting it was and really dwelling in that emotion, that's another process that we code for. And so what we looked at next was, is it something about a specific feature of co-rumination that is going to lead to an increased risk for an internalizing disorder, because some of these map on pretty well to symptoms of anxiety and depression. For example, rehashing details, that maps on pretty well to rumination, an individual cognitive pattern that we see in depression. And dwelling on negative affect also overlaps closely with the persistent sadness or persistent worry that we see in anxiety or depression. So that is what we tested out next, and to see if gender moderates this link, because when we look at global co-rumination in the broader literature, what we see is that co-rumination only leads to increased risk for anxiety and depression in adolescent girls. It's this really interesting trade-off where when you code for co-rumination in boys, other studies have shown doesn't lead to increased anxiety or depression for boys. It actually is linked to a lot of positive outcomes. Boys who co-ruminate with their friends have better friendship quality, they have higher closeness, and then that predicts increased co-rumination, which then predicts continued increases in friendship quality. So it's this real gender difference that we're seeing. So this is very small. But what we essentially saw is this gender-specific pathway. So for example, dwelling on negative affect with friends was linked to an increased internalizing symptoms, but only for adolescent girls. So dwelling on those negative feelings with friends increased anxiety and depression. And then when the teen was rehashing details with their parent, so kind of going over, much more of a cognitive approach, but going over what happened over and over again, also for adolescent girls, increased internalizing symptoms. So we're seeing some ways that friends are impacting adolescent mental health, and some nuance into how parents are impacting mental health. So it's just about a little bit more of the nuance with that construct. All right, so overall, just to kind of pull this together, what we're seeing with parents and friends is that we did see that parents and friends are socializing, they're reacting to teens' emotions in unique ways that very much fit with the structure of that relationship. However, broadly, it was more of the parent responses that were linked to adolescent outcomes, and it was only through looking at some of the nuances in co-rumination that we saw some of the ways that friends might be impacting mental health. So one thing that might be happening, particularly with I'm going to jump down to the dwelling on negative affect with friends. One thing that's been documented a lot by Mitch Prinstein and his colleagues is this idea of an emotion contagion. So the idea that once you get started talking about an emotion with a friend, an upsetting event, because the friends are they're at a similar developmental stage, they're developing their own emotional capacities, they may become increasingly dysregulated by talking about the event, so they're getting distressed, the adolescent gets more distressed, and it just kind of snowballs and creates a much more hotter emotional climate, is one thing that may be going on. All right, so I'll skip through some of this other these other points just in the interest of time. All right, so the last empirical study I'm going to talk about before we talk about translation into therapy is a longitudinal study that measures some of these similar constructs with parents and friends. And this particular study was focused on how adolescents are adjusting to the transition to high school. So we followed them at 3 time points and also did a little bit more digging in terms of some of the gender-specific pathways and how boys and girls are socialized to express their feelings. So we looked at the parent and friend responses over those 3 time points. So do parents shift over time in how they're responding to their kids' emotions as they get older? And also are friends shifting in their responses? And then how does that correspond to adolescent emotion regulation over time? So we had 87 adolescents. We first had them complete measures at the spring of 8th grade, then the fall of 9th grade when they made the transition into high school, and then the fall of 10th grade when they presumably have maybe adjusted a little bit to that new environment. And we had the teens fill out those same questionnaires reporting on how their parents and friends respond to their feelings, and then the parents reported on the emotion regulation, just to avoid having only one reporter across all study measures. And so we tested out these hypotheses using HLM with these linear growth models. And overall, what we saw with regards to the connection between socialization responses and how adolescents regulate their feelings, there were some interesting things that panned out a little bit differently than I would have expected. So if we just look at the models with parents, when parents were really punitive or minimizing of their child's emotions, so these are all discouraging responses, we actually see this improvement in adolescent emotion regulation over time. And the idea here is that maybe they're getting some of that helpful feedback for really dysregulated emotional displays that don't fit their developmental age or the context that they're in. And so this is getting to that flexibility idea that getting a range of responses is good. Unsupportive responses aren't always bad. Sometimes they're kind of helping them mature in their emotion regulation process. And then when parents are reciprocating, so kind of matching their emotions, or when they're ignoring their teens' emotions, that is where we're seeing emotion regulation worsen over time. So example items that would correspond to these strategies, when I got really mad, my mom got really mad. Or when I got really mad, my mom didn't even really seem to notice. So these are all ways in which they're not necessarily, they're getting negative feedback, but it's not to, tamp down the emotion. It's just no recognition of the emotion at all. Or having to cope now with their parents' affect, which could be even more dysregulating. Now with friends, we saw these really gender-specific pathways that kind of map onto how friendships are socialized along gender lines for same-gender friendships. For adolescent girls, their emotion regulation worsened over time when their friends were really punitive to their emotions. So they responded really discouragingly, like, it's silly that you feel that way. And the idea here is that adolescent girls, or girls broadly, are socialized to be very relationally oriented. So receiving a punitive response may be extra damaging in the context of a female friendship, whereas what we actually see in other studies, but relevant to this idea, is that getting boys providing punitive responses to each other is taken more as kind of teasing or joking. How insulting it is maybe lowered a bit because there's a lot less norms around boys being able to express their emotions to their friends and receiving positive feedback. So teasing is kind of a way to acknowledge the emotion, but it's not seen as maybe as offensive, not as dismissive. And that's similar to a pattern that we see with these teen boys. So their emotion regulation improved when their friends either reciprocated their emotions, so they got really mad or really sad too, or when their friends minimized their emotions. So those comforting statements like, don't worry about it, it's not a big deal. And the idea here, because this is actually something that could be seen as unsupportive, but because there are so many gender-specific norms on how boys are allowed to express their feelings, one thing that might be happening is just by their friends matching their emotions or minimizing it, they're recognizing it at the base level. They're not ignoring it. And so having any kind of recognition of their emotions could be beneficial in leading to these gains in emotion regulation. All right. So I think overall, one thing to emphasize before we get to treatment is that emotion socialization is a very transdiagnostic process. It applies to so many different presenting problems that you'll see in clinic, and that the context really matters. So understanding the nature of the family system, their sociocultural context, the youth's gender, their base level of emotion regulation or their kind of temperament, it's all going to shape how this process unfolds and what kind of recommendations that you would make as a provider. So for example, whenever I'm in clinic, one thing I'm often observing is how the teen talks about their emotions, whether they talk about them at all. Sometimes they don't want to. And how they're talking about it with their parents, because those can be treatment targets. You can work on things like helping the parent acknowledge their emotions more, or having the teen be more forthcoming about how they're feeling if they're kind of suppressing their emotions a lot. And then for evaluating their friendships, because we're not going to meet their friends. Their friends are not presenting to these appointments with them, whereas parents usually are. There's more of an indirect approach we can take as a provider. So if I'm working with an adolescent female and we're working on reducing symptoms of anxiety and depression, I might just do a little bit of an assessment in a clinical interview with her where I'm talking with her about what her friendships are like, what her friends like to do, how she gets support from friends or how she knows to ask for support or doesn't, and just getting a sense of what kinds of friendships seem to be promoting mental health and which friendships might be kind of exacerbating some of her symptoms. Because when we're planning our kind of coping toolkit, it may be helpful to know, this person would be a good source of support when you're feeling anxious. This friendship, it sounds like they might make you feel more anxious if you talk with them about something that's going on. So just kind of being really purposeful in planning out their coping strategies. And so some more specific feedback on translating research to practice, and I welcome your all's thoughts on this or how you may have implemented something similar, is that when you're working individually with the child, in addition to assessing symptoms of anxiety or depression or ADHD or ODD, you might also just be kind of assessing where they are in their various emotional competencies. So can they label their emotions? Can they acknowledge more complex and nuanced emotions? Or the fact that you can feel positive and negative emotion at the same time? And how do they regulate? What are the ways that they cope with their emotions? The main thing I'm encountering now with teens is ways to actively cope with their emotions rather than these avoidance strategies like scrolling through Instagram or Reddit or whatever, because it's a way that they're getting out of their feelings, but it's avoidance and they're not actually coping with it at the end of the day. So when they talk about coping with their feelings, what are they actually doing? And then with parents, it's a little bit more of a nuanced consideration and delivery, because I'm thinking about how expressive the parent is, how I've observed them talking with their child about emotions, and also just to offer culturally sensitive care and being collaborative is to acknowledge the family beliefs. In that family system, what are the beliefs and norms around emotions? Because if I'm, as a provider, coming from top down of, you need to validate your kid's feelings, and this family system, they say, we don't talk about our emotions in this family, you don't understand us. I've immediately lost rapport with that family, and it's going to be really hard to be able to deliver that intervention. So a lot of it might just be about acknowledging family beliefs, meeting them where they are, and seeing what might be some helpful initial steps or inroads to be able to work together to figure out some kind of system that is going to be respectful of their family system, but also in line with what we know based on research that is effective for promoting mental health in youth. And I often talk about with parents emphasizing the fit other than right or wrong. So because a lot of times parents might say, okay, so I just have to validate all of their feelings and listen to every feeling they have, and there's no consequences for their behavior when they're acting out because I just need to attend to the emotion. I say, no. It's more about, is that emotion appropriate for the context? And also I'm thinking about the fit between the parent and the child. So what might be ways, based on their particular dynamic, it might be helpful to be able to, the child to receive some validation for their emotions, because it has to kind of land well with the child too. If it feels really dissimilar from what their parents usually do, then it's maybe not going to have some of the same benefits. All right, so one area that my lab's moving into is acknowledging ways to help support healthy families in Appalachia, and using this emotion socialization lens. And I think this is a particularly needed and interesting topic because particularly I've worked as a mental health provider in Appalachia in various regions for about 7 years now. And one thing that I've noticed is that oftentimes we're working with multi-generational families, so there's a lot of different socializers in the family system that we have to consider rather than just mom or dad. Or broadly, we're thinking about who are the caregivers. Especially in my clinical training when I was in Blacksburg, Virginia, we were working with a lot of custodial grandparents. And so that's just something we have to acknowledge and ways to work alongside them. And then also one thing I've encountered is just being very culturally sensitive about whatever area that you're in, what are the sociocultural values regarding emotion expression and parenting practices. Because understandably, a lot of the questions I get from parents are how to regulate behavior and how to deliver reinforcements and consequences and reduce these temper tantrums that are real big behavioral outbursts. And so understandably, if I start talking about how we need to validate emotion, that their concern, rightfully so, is regulating behavior because there's some really big behaviors to regulate. But then alongside that, can we build something in with how can we regulate all the kids' big feelings too? Because that's what's leading to some of these behaviors. And then being trauma-informed, it's an area with a high degree of ACEs, and it's a largely underserved area. So we're serving families from many different regions in Appalachia. And so one way that the team that I worked as part of at Virginia Tech, so I'm presenting some of this was a group that I was involved in but did not necessarily lead, was the idea we can deliver some of these interventions that are more focused on emotion socialization and just evaluate ways to make it fit for the sociocultural context. So there's this parenting group called Tuning Into Kids. It's based on emotion socialization. It's all about how to build emotion regulation, notice your child's feelings, tune into them, and then work to help them regulate. And so my doctoral advisor ran several of these groups, and we video recorded all the groups and then did analysis of the text to see what were some of the active ingredients that led to the groups being really helpful, what were challenges that we encountered that will help us have more culturally sensitive dissemination of this group. And so some of the different themes that emerged that are really helpful when we're thinking about adapting parenting interventions for the families that we're working with was one, there was some questioning about the methods associated with this program. Parents, understandably, were maybe not as, they were apprehensive about some of the strategies, and so it was about working alongside them to explain them and see how they may or may not fit with how their family system runs, and just having more of a, rather than this is the way that we do things, it's how do you think this might unfold in your family, and just evaluate it. And another thing that we noticed is having the parent support among the groups was a really helpful active ingredient. It helped when other parents were self-disclosing some different challenges that they had, and parents were able to offer support to one another, and that greatly increased the group coherence and also just the richness and the quality of the discussions. And then the one thing I'll end on that was really, really helpful for this group is just knowing the region that you're working in. So we delivered this group in a very, very rural county of Southwest Virginia. We partnered with a church to be able to do it. And the only reason we were able to deliver this intervention in the church system is that our group facilitator's father was the previous pastor of this church. So we had these community ties, we had the community network, and that was our inroad. Because if you come down and you email and you say, hey, I'm a psychologist in the community, I love to come into your church and run a parenting group, they're gonna, who are you? Like, I don't know, I need to trust you, I need to know your people before I let you come onto my turf and work with our families. So just having her as the facilitator was helpful, but then also she leveled the hierarchy a lot, where she was wearing the parent hat a lot more than the I'm a psychologist hat and talk and have through her self-disclosures or through her also kind of evaluating the techniques of the group, it really helped them have this nice coherence where they were all kind of working together and then acknowledging the limitations of her experience. So acknowledging the ways in which the parents were the experts in their children or the various things that they're bringing to the table that are going to really help support their ability to deliver this. So really highlighting the parents' strengths as well really helped with the delivery of this group. And one last thing I'll say is related to the social networks. Our group facilitator, like I mentioned, she was from the region, she was from Appalachia, so just having knowledge of various cultural practices and terminology was super helpful. I remember one group, they were talking about going squirrel hunting, and she didn't miss a beat, and she knew exactly what the parents were talking about, which really helps with kind of trust, connection, bonding, rather than seeming confused about the cultural practices of their family, and that may lead to some kind of disconnect. So that was just an interesting observation as well. All right. So where we're taking this is, again, translating this to intervention. The hope is to be able to run some more of these groups and just for wider dissemination of mental health services in this region, but then also to think about ways to adapt it to be fitting the needs of the families in our community, and then also expanding it to consider other socialization agents. So we're thinking about doing more exploration of how grandparents socialize emotion, and then taking more of a positive psychology approach, how positive emotions are socialized, because that also impacts mental health. So the team that, and we've got one team group here right now, Landry, the Developmental Psychology Lab is the team that I run, and we're going to be executing some of these projects in the next coming years. So I welcome your questions or your thoughts or advice as we get rolling with this. All right. Just want to acknowledge all my collaborators, mostly summarizing research I did as part of a group of many people, and all of our families and the various supports we got from funding agencies. So thank you all very much. If you have any questions, just let me know.
Any questions at all? Well, first, thank you so much for such an incredibly well-presented and thought-provoking presentation.
Thank you.
So it raises lots of questions. So I just have a couple. One is, early on you were saying, if I understood you correctly, that the father's involvement in parenting might help with the child's development of emotional regulation, even if, and this is really my question, is that true even if the father's parenting approach is maybe punitive?
That is a good question. I would say if in response to the child's emotions, if they maybe have some unsupportive responses but also supportive, that's where we see the good outcomes. But the idea being that it's important that those unsupportive responses, if they were just there in isolation, that could be unhelpful and lead to some more behavior problems or something like that. But because it's kind of married with also supportive responses, it's more like a blended approach where the kid's receiving a variety of feedback. They're not always getting dismissed or always receiving a lot of encouragement for their emotions. There's some variety there, and the variety seems to be what's important.
Well, thank you. And my other question is, do you have any observations about family systems in the Appalachian area as far as the way that they generally respond to expression of emotion?
Yeah, I think it varies for every family system. I think that when I'm wearing my clinician hat, one thing I'm thinking about is sometimes you do see a higher, more focus on regulating the behavior as the primary goal and less attention to tuning into the child's emotions. But that could be in the context of some pretty severe behavioral problems, and it could be just priority-wise. It's more helpful for me to be able to contain my child when they're having this outburst than to kind of get at their level and meet them at the eye level and say, seems like you're kind of upset, buddy. Like they're regulating the behavior. And so it's about, in therapy, it's saying, yes, regulating the behavior is really important. Let's just add this piece too about the emotion, so that way we're getting the best of both worlds, basically. Because we can't just not acknowledge when they hit their sister or throw something, but we also, so we need to regulate behavior, but we also need to tune into the emotions that's leading them to act out that way. Because they're trying to communicate something. They're trying to say, I'm feeling dysregulated, I need some support, or I'm angry about something. And so both are important, is what I would say. And I encourage y'all's feedback too, because y'all have worked with families in this region as well. So if you have any observations.
Thank you very much
Yep.
for this lovely presentation.
All right, thank you.